We have this man who is really going to share with us responsive caregiving and its effect on children's developmental outcomes, especially with their health outcome.
Okay.
So if a father is present emotionally, psychologically, physically, does it really play a role in a child's development?
That's interesting.
And so to help us go into that discussion, we have Dr. Brian Maugo. He's a lecturer. He's also a neonatologist, School of Medicine, Department of Pediatrics and Child Health, University of Nairobi, Kenya. He is joining us via Zoom. And so, Doc, Brian, if you can hear me, welcome to the Father's Day show brought to you by ECNG, M2M, and Afghan.
Cases because their father really wants to be involved. Now, moving on in terms of fathers being involved in sport, play, and activities of the children. I had some of the colleagues of some of the fathers there talking about taking their children to school, helping out in terms of schooling activities. Those are very essential components. If you're a father, you actually know, you always see what your child does all the really, especially the boy child, they really emulate and copy exactly what you're doing. So if you're having you're responsible, you're not smoking in the house, you're not drinking in front of your children are bound not to actually have these activities later on in life. But if you're doing those things in the house, or you're exposing your child to issues of drug abuse or taking of alcohol, smoking, if you're abusing your wife, all your children will be able to pick these mannerisms, and this will be able to be actually propagated to the next generation. And here we're looking at a child who will actually be mentally abused at this point in time and end up with mental problems and psychiatric issues later on in life. So how the father plays, the role of the father is very important. And it actually has to be correct fatherhood done properly, so that you can shape your children to be able to be better people in societies later on. As you move on to adolescence, that's the most critical point in lives for most of these children. As they become adolescents, they're trying to figure out what exactly is going on in their lives. And a father figure being at that point in time can be able to shape, girls tend to gravitate towards the fathers, and they're more open with their fathers. And as even sons, maybe if they're brought up quite well, they'll be able to pick up their father's habits much earlier on, and this will be able to shape the adolescent period. Being present at this point and advising in matters of sexual health, matters of self-discipline, teaching them about what it entails to be adolescents and all that at that point in time, may be able to shape their future life in terms of their sexual behavior, their work ethics, and how they'll be later on in the university. I think that in a nutshell is what I wanted to say, yeah.
So, Doc, we've had some parents who scream at their children because they think that to discipline them, you have to be that manly figure, strong father, sort of a thing. So keep quiet, shut up, go and sleep. Those kind of utterances. How does it affect the child at that very prime age? Does it really put them on track or make sense worse? Should we encourage that with parents?
So, looking at as much as the matters of discipline is very important. How it's taken or done at that point in time in terms of infancy, childhood, more so in childhood, is very important. Most of these things that we tell our children, putting them down and making them keep quiet and always scolding them, sometimes actually having uh, physical kind of approach in terms of discipline by actually spanking them or using other modalities of actually punishment may have a serious impact on their outcome later on. We're not saying that you should not discipline your child. Discipline your child is an important component of their growth. They need to know what is right and wrong. There are many techniques that you can use to do that. You can be able to talk them down. You may be able to use other ways of punishing them that involve maybe sitting in a corner somewhere, banning them from certain things and activities that they enjoy, and also more so talking to them and having them understand exactly the gravity of what they have done. Now, involvement of other abusive type of behavior in terms of punishing your children has an impact in terms of their mental health later on. These children will be withdrawn. Let's agree on that. They will be withdrawn in life. They will not be confident. You're gonna take away that away from them, and they'll start having issues in terms of depression, if it's there, or having personality disorders that can be quite disruptive. And that's how you end up with children who probably will end up with committing certain crimes, involvement in drugs. They will be abusing that drugs and ending up in jail. They will be rebellious later on in life and participate in crime. They end up taking risky behaviors, sexual risky behaviors, just as a way of rebelling against you. And this may cause a lot of problems later on. Yeah. So we try as much as we can to avoid having that old school type of disciplinary discipline that we were all exposed to. Lifetime is changing, and right now we need to nurture our children quite differently from how it used to be. As much as we always say we ended up where we are now, but if you look back and you look at the kind of stuff that is, we'll be able to replicate what we did, what was done some time back and do it right now, you may end up with a lot of problems. Society has actually moved on, and this is now becoming unacceptable, and people are looking at different stressors and issues that can affecting them, that can quickly impact on and really impact on long-term outcomes for these children. Yeah.
There are a lot of research to that effect. So Rosenbeck and Wilcock 2006 actually came out with a study which was so clear that when parents or when fathers are involved in the nurturing of their children, it really reflects in their IQ. They are more patient and they can handle a lot of stresses, frustrations associated with schooling, and they are much more school ready. What do you make of this outcome of their research as an expert in the field?
Yeah, I agree with that. I think I've come across that study some time ago, and I agree with that. And in terms of cognitive development, involvement of the fathers is quite important. You realize that most of the time, if fathers are involved in actually things like homework, knowledge gaining in terms of reading and writing, and also mathematics and such things, the children do quite well. There's usually a better response to that. I feel like we need to be more involved in what is going on with our children. Has any of you ever looked at the diary from school and kind of signed it? Do you ever see what exactly is happening in school to your child? Are you involved in their schooling? These are things that you need to be part of, and it will really shape. And this is out of personal experience as a pediatrician, and also children that I see at my clinic. You get parents who are more involved in their education. Their children do very well. They're well spoken. They're very intelligent children. They're able to converse with me at a level that I've not seen with other parents who basically their dads are not available, and they're quite engaged. And I believe whatever was found, the findings of that study are quite true to the last word, and we should all be involved completely in our children's schooling and development in terms of learning environment. Yeah.
True, and I can also attest to that fact as well. And thank you very much. So, Doc, what do you think fathers must do going on forward? What must we do in ensuring that we play a vital role in the development of our children, especially the health outcomes?
So I think first of all we need to address the barriers that you tend to have. I think at a personal level, fathers should be able to look at themselves and don't put themselves aside in terms of and if they cannot participate in terms of their children's development. All they need to look and say, hey, we are part of this. We need to be part of this. Now, what has been there throughout are the barriers that have been put against fathers to be able to participate in childhood development. The society itself has actually stated to us that we should be sitting back and let the mothers do it. We need to be part of it. We need to be comfortable, and we need to now be involved in all components our childhood, of our children's well-being, starting from the beginning. If you're able to be there for for those who don't have children or anticipating to have children, being there during pregnancy time may have a bigger impact. I right now seeing some parents and my children who are in the hospital. Some parents look like I'm seeing their mothers on their own. The fathers have disappeared. The mother is actually quite depressed. You being part of that kind of environment as a father will actually be able to alleviate the mothers from having postpartum depression, which has an impact on their children. The follow-ups in the clinic, this will having yourself engaged in what the children are going through in the clinics, the first 1 year or 2 years when they're going for growth and monitoring, being there, even if it's not being there, having an understanding of what exactly is happening at that point in time. You as a father, you should be able to guide and be able to say, hey, have the immunizations been done? Has the baby gone for growth and monitoring? Cheering, being a part of the cheering squad for your wife and your child when they actually add weight, when they get the vaccination, when they go to the hospital for sick, when they are sick and they are going on to gone to the casualty or the emergency department. The presence of the father is very important because I always see mothers coming into the emergency and the dad is not available. It's usually heartbreaking for the mother because they cannot be able to cope. You being there will be able to help the mothers cope, and also at the end of the day, your children will be able to know your presence there. At this point, the baby wants a lot of that. Even if they're being admitted in the ward, you need to be there as a father. As you move in terms of their education, their learning, I think away from saying these are mother's tasks. You're the one who takes care of school. Take time, be there, create a timetable, create a schedule on who's gonna take that child to school. The other day, I missed taking my child for probably a month from taking my child to school. The first thing he asks is, "Why are you not taking me to school, Dad? What has happened? Are you so busy? Are you not available?" But the time I looked at that and I realized that my child is growing. This is a 6-year-old now, a young man, and is trying as much as he can to gain a lot from me as the father. So my absence, which was at this point for like a month because I had to travel, I was busy and I needed to move in and out of the house, and I couldn't really had time to take my child to school. He really could see that I'm actually distancing myself from him. And he asked that question. So that day I decided, you know what, I'm going to just stop everything, pick up my vehicle, go to school and pick him up. We went and spent time with him, actually in the parking lot, sat there, discussed a lot. And up to today, this is 1 month later, he's still talking about that and actually saying, wow, that was a wonderful experience for him. He's now looks more confident. The bonding with me is back again. But just a short period away from your child can actually make them lose that personal touch or that touch of their father, and this can have an impact on them. So be present in all matters. You know they're going to go into adolescence. What are you ready for adolescence? You should be able to prepare yourself. Those hard talks that you need to talk about in terms of sexual development, nurturing of your son, nurturing of your daughter, where do you come in? You need to be able to be ready for those questions and answer them. Your child is not gonna be taught some of these things by the world. That is the wrong way to go. If you leave your child to understand certain things that are provided out there, you know what Google can do when you press certain words and put in certain words in the Google search, you're gonna get certain abnormal findings, and these are gonna deviate your child's perception of sexuality, your child's perception of what is actually meant to be done, and you end up with a lot of trouble later on. So we need to step up, we need to come into the front and actually be part and parcel of child development. All this will shape the child's health later on.
Rightly mentioned a point that is very important. For example, when you go to public hospitals, you mentioned that men must be involved in the antenatal visits to the clinics with their wives. When you look at our public settings, what I've seen, I was able to attend all the antenatal sessions with my wife because it was a private hospital. You just walk in to see the doctor and you don't join any queue and such instances. But men sometimes feel joining the larger pool of women, they feel a certain way, they feel shy. So if we would want to encourage more men to really accompany their wives to these sessions, how are we also changing the situation in the hospitals to accommodate more men so that men will feel much more comfortable they will feel much more welcome to follow, not to follow, to just go for these visits with their wives, because we've come to know that it is very, very crucial and important.
I agree. I think all public health, everywhere, and they are very allow fathers to be part and parcel of the throughout time. Hospitals, maternity, children's wards are not for men. But I'll take example of where I work at the National Hospital. So we have engaged in what we call family-centered care, and this is where the mother, the father are involved. This required a lot of upscaling in terms of uh, communication and actually putting it out there in terms of fathers are actually meant to be part of the care. When fathers come to our unit, we always welcome them in with open arms. The nursing team is quite supportive. And I think that's where it all starts. Are the healthcare workers able to welcome these fathers who are feeling shy, find out their fears, and actually express to them what the importance is of them being there? So we now find that fathers are involved all the way from the nursery for babies who are sick, where I normally work. I deal with small babies, the prematures, babies who are going to be in the hospital for quite some time before they go home. And you get fathers coming in and involved in issues in terms of washing the babies, having what you call skin to skin care, where they hold their babies close to the skin and stay with them there. This allows for we call it kangaroo care, and it allows the babies to actually grow much faster. The bonding starts at that point. It gives a break to the mother. The father feels more confident in terms of what is happening. While in the ward, we now welcome fathers to be able to, some of them, for some of our babies, we allow the fathers to be able to be present even longer than what was usually there a few hours. Some have accommodation that they can be able to stay there with their wives and their children, and that is more, probably they have to slightly pay more of their pocket. But in the public health sector, we are looking at trying to redesign our rooms, redesign our spaces to be able to accommodate the father. I know most moms will be, most of the facilities are designed just for the mothers. You don't have fathers' toilets. You don't have places where fathers can be able to even sit down and talk with the other fathers. So these are things we need to be able to create in our spaces to be able to allow our fathers to be to be able to participate in all this healthcare of their babies. At the clinic level, are the fathers being involved in the communication that is being given to the mothers? Nurses in our units, in our health facilities, at the outpatient centers, always ask their mothers to come with their come with their husbands, so that when they are being given any form of communication or healthcare information, the father is always there to be able to understand. And it's always important for these mothers. We give them tokens sometimes to be able to say, hey, you bring the father next time, this is what you're gonna get. This transport is free, and all those kind of things. So it's important for us to be able to push this information out there that fathers are actually important in terms of care at hospitals or wherever, even the outpatients, inpatients. Healthcare is very important, and fathers should be involved in that. Yeah.
Last thing, we want you to share Father's Day messages. Is there anyone you want to send a special message to your dad, to some colleagues? You have the opportunity to do so.
So personally, I would like to send three messages, Father's Day messages. First of all is to my dad, of course. I love him very much. He's been quite supportive throughout. I am who I am because of what he has done. We're very close, and I'm glad that we can be able to still hang out and have discussions almost every week with my dad, just to figure out what to do in terms of investments and taking care of our children, and what other sports activities, like going out for a couple of golf or whatever, tennis that we do all the time. So it's important. I wanted to just say thank you, Dad. And also I wanted to say Happy Father's Day to my friends. These are male doctors who are part of this profession. We know we're out there working hard, leaving our children at home, but I know you're trying your best in terms of taking care of these children of ours. And finally, I want to say Happy Father's Day to the fathers who their children are in the hospital. You guys are the best. You're doing what you can. You're there and you're supporting your families. They're going through a hard time. And I'd like to say Happy Father's Day to you. Thank you so much.
Thank you very much, Dr. Brian Maugo. He is a neonatologist and a lecturer, School of Medicine, Department of Pediatrics and Child Health, University of Nairobi, Kenya. Thank you so much for spending the best part of your day with us as well. This has been very educative, and we'll be coming back to you for more. Great. So, Ajiman, he really touched on two key things, and because we don't have too much time, I will just pick on one.
Sure.
Has to do with the fact that we need to really kind of, I don't want to use the word modernize, but we need to create space for fathers to accompany or to go for these antenatal visits with their wives.
Yeah.
Because they also play a very key role in that session.
Sure.
I can share my experience because I went through all the sessions with my wife, and I could ask certain questions and I could make certain contributions to the entire sessions, and it was very important. But in the public space, in the public hospitals, they gather all the mothers. So sometimes it's a bit, you know what I mean, for the men to be present. What do you think we need to do?
I think there's been a tragic social stigma where, you know, only women are the ones. You find women alone with their children go for the weigh-in and then antenatal.
Absolutely.
It's like a man there, but it's like unheard of, an abomination. What are you doing here with a baby?
Absolutely.
Are you okay? But I think that according to what Doc said, we are seeing a revolution of men in the 21st century, who actually understand that they can do as women can do. You know, what a man can do, a woman can do. So if you can take the baby to the antenatal, I can also do the same. It's our baby. So it's going with the days where the man says fold the arms, woman with the baby, that's all the hard job. Today, men have resolved to also take part and share in that feminine responsibility, to say in quotes, whereby we go the extent of now visiting the hospitals with the baby, checking their weight and all that. It's fun, you know. So don't call a man.
It's actually. I mean, when I take my son to the hospital, I get some people watching, and I think now we have more men doing so because you receive some extra care from the nurses and the health professionals over there. And I think it's something that we need to encourage. So if you're a father there, a young father, if you can do it, please don't be shy. Just walk to the hospital with your wife. Exactly, and please do so. It really helps. It makes you understand a lot of things that the women go through, and even not for your wife, at least you understand the development process of your child as well. So I think this is very crucial and very important. And I think there are some messages that are coming in.
So we have this from Maranatha, and she says, Happy Father's Day to our beloved daddy, Mr. Samuel Nanadebra. Your daughters are very grateful to the love, care, support, and protection you have shown to us. Today, heroes are being celebrated, and I wish to celebrate my hero too. You were such a wonderful dad, and everyone will want to have that from you. So with much love from your daughters, Sandra, Deborah, and Jessica, and Nim Deborah, happy Father's Day to you. And we have this from Elizabeth Amwakwa Opon. She says, a lovely Father's Day to you, Father, for bringing 4 champions to make the world a better place. We are proud of you. Elder George Opon from Salem SDA Church, Accra, Ghana. And many more. So, Kate, you know, the last one Doc mentioned was that, you know, parents think that they can shout to their children. This sort of manly approach to child nurturing was of concern to people. And I think he made it clear that it's not about you being so manly, shouting, pulling canes and all that, punitive or corporal punishment to bring your children to be disciplined. I'd rather you have to relate with them. You know, everything the child does, according to him, it has a reason from their point of view. As very fragile as they are, they have their own understanding, the way they see things. So you need to get to their level to understand why they are doing messing things up in the house. Perhaps join them. Maybe they'll be engineers one day.
Sure. I think even we have moved on from punishment to positive reinforcement and other things. There are various ways to really kind of check on your child rather than abusing or using punitive methods. So I think that, and research has proven, if you beat your child, if you cane him, subject the child to a lot of hardship and all the other. It doesn't do anything better to the child's development. I know some of these things are very crucial, but we will understand them much more better.
So a quick one here with to Emmanuel Muzo, Dennis Bright, and Smoke wish you a happy Father's Day. And from Jenna Opoku says, Happy Father's Day to you, Dad. And Jenna, though, apology to you for all that, but thank you so much for bringing in your wish.
All right. So don't forget that this show is brought to you by the Early Childhood Network Ghana, Mothers to Mothers, M2M, and then also the Africa Early Childhood Network. We'll take a short message from our partners, and when we return, we'll get into the most exciting session, the Nurturing Care Challenge, where our young fathers will be doing their own thing whilst we watch. All right, stay tuned.
My name is Yvonne Prempe Ferguson. I'm the technical specialist and country lead for M2M in Ghana. Mothers to Mothers is an African NGO based out of South Africa that works in 10 countries, and in the last year and a half have prioritized Ghana as a country for expansion of our integrated RMNCH and ECD model. Working out of 2 sites in Ghana, in Atwa Government Hospital and Ashiaman Polyclinic, we provide much needed life-saving services for HIV positive and HIV negative pregnant and breastfeeding mothers, their children and their families. In Ghana, we are also mitigating the devastating effects of COVID-19 by implementing a client-centered interactive e-service delivery and a virtual mentor mother platform. Use of the e-services and the VMM platform eliminates the risk of COVID-19 infection for staff and clients and rapidly expands our reach in the context of COVID-19 by fully integrating our digital services through command center hubs and live client support and virtual drop-in centers through contactless interactions. Implementing a hybrid model in COVID era that combines safe, protected, face-to-face interactions with e-services, including the VMMP, has enabled us to reach high-risk clients and other hard-to-reach clients with routine vital services. The VMMP is an interactive tool that runs on WhatsApp. It enables users in our 10 countries where we operate to access vital health information and service referrals on COVID-19 and other health topics from a trusted source at their convenience and in their preferred language, and which they can easily share with family and friends. In Ghana, the VMMP is available in 2 local languages. It is available in Twi and also in Dangme. The VMMP makes it possible for anyone with access to a smartphone and the internet to access health education and vital risk reduction information. Let me walk you through how you can enroll in the VMMP. It's very, very simple through some few steps. First of all, you save this number 0242 426504 in your contacts as M2N Ghana. Secondly, you look for this contact in your WhatsApp and send a quick hello once you are on WhatsApp and press send. And you're ready to interact with the platform, because a list of options will be available to you and you'll be able to browse depending on the information that you're looking for. The VMMP targets our mothers to mothers clients, women of reproductive age 15 to 49, adolescent girls and young women 10 to 24, as well as their male partners, regardless of age and HIV status, people living with HIV irrespective of age and gender, those living with other chronic illnesses like hypertension and diabetes, and everyone in our landscape, including you and I. The VMMP marketing plan serves to improve the platform's reach and ensure that processes are put in place to encourage sign-up to the service, maintain traction, and share the VMMP service with others. I welcome you to enroll on the VMMP. Thank you.
One painting primbotum aminwana. Oh ho, ponton prombotum aminwana. Oh ho, imbrikisi botum aminwana. Oh ho, I want a suro asaso what dentity odumankuma. Odumankuma. I want where you put ye. Sawa hum do, but a wound swing you. Aye. Fathers, I want one dini atrawamba ison. There's a man berbe ya no jina ni be son fudo. And rapper was so suaye who wimi or ye a kue son. Jericho afesu, who trahu impene son jugui. At a turn upon a me son. Intis a chitama obroda. Nakasa abahu, o Sunday, Nippon biara yetako. In the son and young coupons bo riase na oshrado. Santum frefreja. A money risha one nanto. There's a one you always see one. Like as my father always says, Nakiat, with determination, you will turn your adversities into opportunities. And you soar above life trials like a majestic eagle flying in the sky. Nakiat, you can be anything you want to be because you were born to be. Thank you very much. Midahum Nara Ase.
Hello, my name is Kwesi Sam. I am the coordinating director for the Early Childhood Network Ghana. The Early Childhood Network Ghana is a registered non-profit organization based in Accra, Ghana, established as the national network for all early childhood care and development practitioners, stakeholders, and organizations with a mandate of providing ECCD-related services, interventions, and programs in Ghana. ECNG serves as a common platform to champion excellence and collaboration in protecting children's rights, influencing policy and practice, strengthening partnership, and share experiences and ECCD knowledge in Ghana and beyond. The network comprises local and international government organizations, civil society organizations, academia, researchers, government agencies, and ECCD private practitioners in Ghana. ECNG is affiliated to the Africa Early Childhood Network AFCAN, based in Nairobi, Kenya. The network also is affiliated to the Early Childhood Cluster of the African Union's Continental Education Strategy for Africa, CESA 1625, and the Association of African Universities. ECNG works through 5 core programs to guide collaborative partnership effort towards the achievement of improved child outcomes, that is quality education, healthcare, nutrition, and social protection for all children in Ghana. Our core programs include research and knowledge management, strategic advocacy, strategic networking and capacity development, webinars and conferences, and resource mobilization. Most importantly, ECNG serves as the ECCD policy and programs implementing arm of the African Union's CESA Early Childhood Cluster and AFCAN in Ghana. Follow us on all our social media platforms, Early Childhood Network Ghana on Facebook, LinkedIn, Twitter, and Instagram. You can also visit our website, www.ecnghana.org. Thank you.
Hello there, my name is Ajiman Ochedakwe, and on behalf of the Early Childhood Network Ghana, we're on the street to interact with people with regards to their fathers. We want to find out from them the role of fathers in child upbringing, and also what special thing their father did for them when they were infants. And finally, a special moment they could share with us about with their fathers while they were children. So don't go anywhere. We'll talk to some people and they will tell us what their view is about their father on this Father's Day program. Don't go anywhere.
My name is Sarah Otu. I believe that if a father after procreation must take the necessary responsibility so that the children will do same at his old age. However, many fathers of today are fond of denying the responsibility of taking care of their children, leaving the whole responsibility to the mother. I personally do not have any good experience of a loving father, so I can't share any good memory.
Say love a door the way
My name is Fred Nizigli. Their role is to help their children become good, and they'll treat them well and let them become rich in future too. The one thing I can use to remember my dad is he pays my school fees a lot. Even I don't get bothered in something like in school. Yeah, he always helps me in school when something is school. Yeah. You know, once I was a stubborn child, and he always lashes me. Like I don't really listen, so yeah, he always thinks me. I'm a good boy. He still loves me. Yeah, I'm a good boy. Dad, I love you out there. You know, shout out to Fred, John Zigley. I know you love me so much, and I love you so much. God bless you.
Well, actually, for my part, I think that every father needs to love his child accordingly. There should not be a separation among them. Because most fathers out there, they really love others, that's their kids. They bring separation between them and those stuff. So I think that, from my point of view, I think that every father should bring his child closer to him and love him the way that the child deserves. That's what I can say. Let me say that for my dad, he has been a very great father to me, and I always pray for him though. And I think when I was a kid, the most memorable thing I can recall about my father was that I think it got to a time that money was not at home, and he makes sure that he always go out there to get money for us. And although his work was not that good, but he always makes sure that he can cater for us and give us what we want, for us not going out there to be begging for money. Well, I would like to say thank you to my dad, and God bless him, and God should grant him the agents that he needs so that we'll be able to take care of him the way he wants us to do.
My name is Goswe Vanderpoy. Oh, as we all know, one role a father plays in our lives is to cater for our upbringings and to see us in a higher height. That is one role that I think fathers always played in our upbringings. One of the special moments that I shared with my dad when he was alive was one very Sunday. That was a Father's Day actually, that we all went to church. After church service, we came home, had fun together, and we went out to one of the hotels near us, that is Anita's Hotel, and we shared a very nice moment together with my siblings. Oh, my father used to play very, very important roles, like pay my fees, and to our well-being, he was a very responsible, if I should say, very responsible father. I wish he was alive to at least appreciate all that he has done for me.
For me, I think fathers should be there all the time for their wars. And then, anyway, it's not biblical, and I haven't read it, I haven't seen it anywhere. But what we African women do is, so far what I know is, we train our male child to go to school and then to learn and have a better future. But we leave the girls at home whilst they go to the kitchen to cook. So at the end of the day, we realize that women end up doing everything in the house, and then we leave the male boys behind. In the same way, when they grow up, they don't know how to take care of their kids. They don't know how to do anything because all depends on the way we brought them up. But I think this is a challenge, and it's about time for we women to train our male child how to do house chores and then a lot of things at home, so that when they grow up, they will become good fathers to help at home. I happen to stay with my dad, with my other siblings, 2 kids. And in fact, we didn't grow up with our mother. It was our father who did everything for us. In fact, the only thing he couldn't do for us was, he doesn't know how to prepare food. He couldn't prepare food. But he made sure he buys food from outside for us, which is the best. He buys nice food for us. Every morning, if we have to buy porridge, he goes with that. We look for a place where the son needs food, and then he buys it for us. That was how we grew up. So for my father, he did his best for us. Oh, I've missed him. My father is late. I wish he were alive, so that even sometimes when I go to visit him with my kids, he used to carry them, go around to buy things for them. And in fact, I've missed that moment. How I wish he could be alive.